Hello, Dr. Olguner.
Hi, Jay.
It's great to see you again. We have another very exciting topic today, which is liposuction.
Great.
I believe it's going to be very helpful for us to clarify some of the aspects of this surgery, if you don't mind.
Yeah, I'll be glad to answer all your questions.
That's great. Then let's get started.
Yeah.
Is liposuction a suitable procedure for me, and which areas can it be applied to?
Beginning from your second question, liposuction can be applied to local fat deposit areas like flanks, thighs, arms, under the chin area, generally buttocks, hips, and also back and generally all the abdominal area. Whether the patient is suitable for this surgery or not depends on general health condition, the overall body appearance, some habits like smoking, alcohol consumption, and also the medications the patient is on. I mean, if you're having a blood thinner, it should be ceased before the surgery.
So who should come to you for liposuction? As we say, let's say, can you consider this surgery to be done?
This surgery gets rid of local fatty deposits. It's really important to understand that. So if the patient cannot get rid of some contouring abnormalities, even they are on a diet and doing their exercises, those areas can be treated by liposuction.
Great. So what I understand from what you just explained is that it's very possible for this procedure to be mistaken as a weight loss method. Is it correct?
Yeah, this is really important. Thanks for the question, and I've really emphasized that this surgery, I mean liposuction, is not a bariatric surgery. It's not an obesity treatment. We are not performing it to end up with a weight loss. I mean, it's not a weight losing treatment. It's rather a body contouring treatment, and patients should really understand this.
How much fat exactly can be removed by performing liposuction? And is there a safe limit to it? If so, what would it be?
Amount of fat to be removed depends on patient's general health condition, surgeon's decisions, the expectations of the patient, and also there are some limitations, of course. In a single session, almost 8 to 10 pounds, in other words, 4 to 5 liters of fat can be removed. And again, I would like to emphasize that it's not a obesity treatment, it's not a weight loss procedure. We're doing it for body contouring.
Are the results permanent, and what happens if I gain weight again?
Okay, once the fat cells are removed, they're permanently removed. So there will not be a regeneration of the fat cells in that region. However, the remaining fat cells can hypertrophy. I mean, they can gain size in case of gaining weight. So they can deposit more fat cells, more fat tissue, I mean. So it is really important to stay in a stable weight and keeping a healthy lifestyle.
What is the recovery process like, and what are the things to consider after surgery?
In the early period, the patient probably will have some swelling and bruising and numbness, also some soreness in the surgical region. But with the evolving technology, operational time and surgical trauma is getting lesser and lesser. So all this kind of stuff decreases the complications. It is crucial to use the compression garments provided by the surgeon for a better contouring and decreasing the edema during this period. Also, a general healthy lifestyle, keeping up with your diet, avoid of alcohol and smoking also help getting better results, I believe.
Great. Will there be sagging after surgery?
Well, it depends. It really depends on the patient anatomy. If there is a sagging or near close to sagging condition in the patient, yeah, after the liposuction, if it's done aggressively, there will be a sagging. But The technique used, the aggressiveness of the surgeon, and patient expectations, again, are important criteria for the situation. If it's done correctly and with meticulous approaches, I don't think there will be a sagging after the liposuction.
Got it. Another important questions, I believe. Does liposuction help improve the appearance of cellulite?
I think liposuction cannot be done to treat cellulitis. It may somehow help in the overall picture, but in my opinion, the treatment of cellulitis is not liposuction.
Understand. What are the risks and possible complications of the procedure?
Again, in the early period, there may be some bruising, soreness, tenderness. Blood clotting is important about this surgery. General health condition of the patient is really important. Habits, if previous medical history is really important. Some patients may have some tendency for blood clotting, and it should be detected before the surgery. And some patients may have a tendency for easy bleeding, So all these factors should be addressed before the surgery, and when taken into consideration, the risk of having complications will be less. And in general, every surgery has a risk of infection, and it should also be really closely monitored.
Thank you. And what are the alternative methods, or are there any alternative methods for fat removal, and how effective are they?
There are some minimally invasive procedures for fat removal, but results are usually much more subtle compared to surgery. So they can be used in small areas, actually.
For today, on this topic, it will be my last question to you. What are the pre-operational requirements for a patient?
Pre-operational requirements are about general medical history. What are the habits of the patient, general health condition, again, if there is a tendency for blood clotting, if the patient is using blood thinners, if there is a condition about easy bleeding, they should all be taken into consideration.
That's great. Again, I think it's been a very informative question and answer session today, and thank you again for taking time to answer my questions.
Thank you very much, and please note, for the patients needing further information, they should feel free to contact with us. Thank you very much.
Great. Thank you.